Next slide. We would like to begin first by acknowledging Indigenous peoples of the lands where we sit today. What is now Colorado includes the lands of the Ute, Arapaho, Cheyenne, Dene, Lakota, Apache, Puebloan nations, and many tribes. Indigenous communities live today with the trauma of genocide, ethnic cleansing, stolen land, and forced removal. And we acknowledge a commitment and responsibility in improving relationships between nations and our own understanding of Indigenous people, their cultures, and unique contributions in art, language, agriculture, food, and the communities, among countless other contributions. Next slide, please. Well, thank you all. My name is Jack Becker. I identify as a white heterosexual male in my mid-30s. I have short, brown, curly hair, facial hair, brown eyes, wide-rimmed glasses, and I'm wearing a stylish button-down shirt some might describe as Broncos colors. And so I see that many of you have already started to introduce yourself or done so. So as we continue introductions for the rest of our project team, I'd invite you to continue to share about yourself or describe yourself. We're including visual descriptions because we believe it's an important marker of inclusion. It can help people with a visual impairment identify who is speaking. So I do want to introduce the project team, the Civic Consulting Collaborative, along with our partner CREA Results. We're pleased to be working with HCPF to engage trusted voices in our communities toward creating equitable access with Colorado's home and community-based services. The collaborative is a unique member-owned cooperative, and our consultants help navigate challenging social and environmental issues by ensuring community is at the center of systems change. We have worked recently on Colorado's behavioral health transformation, and our team has significant experience working in health equity to bring together government, resource providers, and service users in our community. CREA Results has long worked to ensure health equity in Colorado with a focus on immigrant and Latino communities by working through their well-regarded Promotores de Salud community health worker model. Amy, will you please introduce yourself, and then Rashawn, and then Fernando.
Sure. Good afternoon, y'all. Thank you so much for joining us. I'm Amy Engelman with the Civic Consulting Collaborative. I am a white heterosexual female, cisgender female, and I am in my mid-40s. I have brown, long, curly hair and green eyes. I'm wearing a not so exciting gray sweater, light sweater, because somehow it's still cool out in June in Colorado. Rashawn, I'll pass it over to you.
Hi, everyone. My name is Rashawn. I use he, him pronouns. And I am also part of the Civic Consulting Collaborative as part of the team for the project. I am a cisgender African-American male in my mid-30s. I've got brown skin with freckles, curly black hair that's pretty short right now. I have black rimmed glasses with clear lenses, a little bit of facial hair, and I'm wearing a black denim button-down shirt and sitting in my home office, and very happy to be here with you all today. Fernando, you want to round out our team?
Good morning, everybody. Fernando Pineda with CREA Results. I am a male, heterosexual, Mexican. I went to Qatar, and many people there thought I was from Pakistan. So maybe I'm not your traditional stereotypical Mexican face, but I do have beard and a long nose and hair that sometimes goes to the side. And today I'm sitting at my home office, and it's a pleasure to be with you all here today.
Thank you. We're also going to hear from Bonnie Silva and Tasia Sin today. Bonnie, would you like to introduce yourself, and then Tasia?
Sure. Good afternoon, everyone. For those of you that I haven't had an opportunity to meet, it is my honor and privilege to serve as the Director of the Office of Community Living here at Healthcare Policy and Financing. That office is responsible for the administration and oversight of the programs that support people with disabilities and older adults. I am a Caucasian woman in her early 40s. I have shoulder length brown hair that is slightly curled today. and I have black rimmed glasses on, and I am wearing a black blouse with white speckles on it. I use she, her pronouns. Tasia, I'm gonna tag you.
Thanks, Bonnie. My name's Tasia Sin. I work with Bonnie in the Office of Community Living, and I've been working with Civic Consulting Collaborative and Career Results on this project as the project lead. So I'm really excited to get to share what we've learned about throughout this project. I am a white woman in my mid-30s. I've got long blonde hair and wear glasses. And today I'm wearing sort of a red-purple shirt. And I just want to acknowledge some of the other folks from the department who's been working on this project. We have a long list of some people who've been really supportive, and you may have heard from last time. We had Kidron Backus, Stephanie Lopez, and Aaron Munoz really help us on the engagement portion of this. And then we had Tamara Keeney and Leanna Major and Aaron Green supporting the sort of research and equity side, and Max Winkler and Jennifer Larson supporting the Zoom work, or that we know that's a lot of work. And then we have Haley Gleason, who supports me and Bonnie as our sort of, she's my boss. So with that, I'll hand it back to Jack.
Thank you. So today we're going to share an overview of the internal equity analysis findings. We're going to discuss with you our approach to meeting with community-driven organizations to learn about how they drive health equity in their communities. You're going to hear from several representatives from organizations in a discussion that we're going to have. And then we're also going to share with you our draft recommendations for HCPF as the result of this project. Next slide, please. We want to be sure we're keeping everyone's wellness at the center, and we are relying on each of you for support. We hope to have some opportunities for people in the audience to come off mute and share. And so if we have those opportunities, we ask that we each review these standards to help guide your comments, your stories, and our collective interactions. We do have a large group. So I think in terms of Zoom etiquette, we'll just sort of rely on one another to make sure that we mute or unmute appropriately and have appropriate images on screen. We do recommend that you use the speaker view so that you can see presenters along with the presentation, and we'll be doing some work to help spotlight people who are speaking. So now I will pass it to Bonnie Silva to do an overview of the project and equity study.
Thank you so much, Jack. And again, welcome everybody. I appreciate you all taking time out of what I know are some extraordinary busy lives to spend the next few hours with us engaging on how we can increase equity and access to long-term care programs. So I have the honor of grounding our presentation in the why. So in looking at how Colorado would leverage really what has been a once-in-a-lifetime opportunity that was afforded to us with federal funding resulting from the American Rescue Plan Act dollars, we asked our community, we asked ourselves, what are the problems that, years from now, we want to be able to point to as problems that we looked to find resolution for and to solve. And at the top of that list with how to use this funding was to better understand the intersecting equity issues in Colorado's long-term care programs. So our purpose today is to identify solutions to increase equity and access to home and community-based services, and to identify community-driven solutions that are geared in particular towards greater awareness around these programs and thus, hopefully, greater enrollment into these programs for people for whom we know are eligible but are not accessing them. People with disabilities who are enrolled in Health First Colorado which is, friends, if you could just make sure you're on mute, I would greatly appreciate it. So people with disabilities who are enrolled in Health First Colorado or Colorado's Medicaid program, we can look at our data and we can see that they are a diverse population comprised of many backgrounds, ages, races, ethnicities, ranges of disability types, and co-occurring health conditions. These intersectional identities influence people's healthcare preferences, their needs, their choices, as well as their experience in our healthcare system. Our project here has focused on health disparities, which are defined as differences in health outcomes between populations due to socioeconomic factors or population characteristics. So while disability is often a primary lens for evaluating health disparities, our equity study that we're going to talk about today and the work considers those additional identities, especially the race and ethnicity, to understand how it is that members enroll in, navigate, and utilize long-term care services within the Medicaid system. So today's discussion is an opportunity for us to share the findings and recommendations from the project team. We are also going to have the opportunity to hear from a few community-driven organizations throughout the state that work with these diverse communities. And we recognize that we have a large and varied group. And while some of this information may not be new or surprising to some of you, it may be for others. So I ask that you share from your experience and inquire about the experiences of others as we dive into our discussion today. So if we can move to the next slide, please. So this is the second Equity Summit, and understand that many of you may have not been able to participate in the first one. So I am going to go through a few grounding slides that I covered in the previous Equity Summit, just to make sure that as we do the deep dive into the discussion that we have today, we all have the same foundational information. Certainly feel free to put questions in the chat that you might have, but I am going to sort of work to cover some of this fairly quickly, understanding that much of the information is a repeat. So, as I said, the American Rescue Plan Act 3.01 equity study really is aimed at helping us understand who receives home and community-based services in Colorado. What our data shows us is that people are more likely to be white and English speaking than the overarching Colorado population and the general Medicaid population. The contributing factors to driving inequity are unclear to us. This project will help us better understand who receives these services in Colorado, what gaps they are, and really help us develop a targeted action plan to ensure that Medicaid home and community-based services are available appropriately to all Coloradans who might qualify. So there have been three phases of this project. The first phase was an internal data analysis. Our data team, which is extraordinary, shout out to them, looked at our data to identify disparities in the home and community-based services by analyzing our Colorado Medicaid data and conducting a literature review. Based on these analyses, the departments are developing a report that identifies the disparities across the system. This report and their detailed findings from our internal data analysis and literature review will be published later this year. So just want to flag for folks, our intention is to be transparent and to share that information broadly. The second phase was external stakeholder feedback and recommendations. So the project team that you've heard from today have conducted stakeholder engagement, and they've used that stakeholder engagement to produce draft recommendations and key findings that, again, they will be presenting to this group today for review and feedback. That purpose of that engagement was to make sure our recommendations really do create opportunities for the department to more fully and equitably serve all eligible Coloradans with disabilities. And then, of course, the last phase of this project is to make sure that we have a solid implementation plan. So once those recommendations are gathered, the project team will put it together in an implementation plan. based off the recommendations, and the department will begin, I think, on a very important path of creating more equity in our long-term care programs. If we can move to the next slide, please. So I want to talk briefly about a little bit about what the data actually showed us. So this graphic shows the prevalence of disability in the overarching Colorado population. So looking at US Census data, which allows respondents to self-report in 6 different disability categories. This graphic shows that people who responded in 1 or more in 3 different age groups. I think an important thing to keep in mind when looking at this data is that prevalence is not the same as disability severity, which is used to determine eligibility in HCBS. So this is not a perfect apples to apples correlation, if you will, but nonetheless, we would expect to see a higher representation in home and community-based services for Black and American Indian and Alaska Native members in particular, if we're looking at just the prevalence of people who self-identify with a disability in our overarching Colorado population. And older adults, Native Hawaiian and other Pacific Islands, though a smaller population, also have a higher rate of disability, as well as Hispanic and Latino older adults, while individuals tend to have less prevalence across all age groups. So what this information tells us about people with disabilities is that they are in our community, and we need to understand who their go-to trusted resources so that we can help connect them with services for which they might be eligible. So just at a very high level, the US Census is looking at hearing difficulty, vision difficulty, cognitive difficulty, ambulatory difficulty, self-care difficulty, or independent living difficulty, which again is not quite the same as what is required for long-term care eligibility, which is a demonstration of hands-on support in several of those areas in order to qualify for long-term care. So just to thread that needle, for those of you that may not be deeply connected to how long-term care eligibility is completed. If we can go to the next slide, please. So after looking at prevalence, we then looked at who is eligible in our programs right now today. So for children with disparities show up most in the American Indian, Black, and Hispanic or Latino populations. And just a note for you to consider, we compared the HCBS enrollment to the overarching Medicaid enrollment rather than just the overall state population to try to better capture who might be eligible, as we tend to see lower income people of color, thus higher eligibility rates for Medicaid. If we can go to the next slide, please. And so when we look at adults, we see that American Indian and Hispanic, Latino in particular, are underrepresented when looking at our own data. So when we look at disability prevalence and enrollment trends for the overall Medicaid population, we would expect to see more representation in home and community-based services, especially among the Hispanic and Latino populations. If we can go to the next slide, please. So this slide shows our guiding logic for identifying these compounding disparities in home and community-based services, and helped us frame where we wanted to focus. So while we see disparities along the continuum of awareness, access, and utilization, the biggest disparity from our internal analysis is in the representation in those home and community-based service programs, meaning that people are either not aware or not enrolling in those programs. People of color, especially Hispanic and Latino folks, are underrepresented across the board in HCBS programs. While this information, with this information, we plan to focus on boosting enrollment among these particular groups. It helps us figure out where do we need to focus our efforts and in which communities. And so while this is intended to recap of the study that was previously presented during the summit, please know that there's much more work going on in our 63 ARPA projects. So just to name a few, to enhance our HCBS services here in Colorado. This includes using equity as a lens to implement across our entire system. So we have added this equity lens into every single project to figure out how that is considered in all of our efforts across the board. We want to focus this project in this moment in time to make sure that people who are eligible for HCBS are aware of it and are supported to access these services. I think that I see many familiar names on this call. I think we have a propensity as a community to quickly go to how we can improve the services that are available. So for today, I would ask that you focus your energy on access to said services, not necessarily how we can improve those services. Not that your feedback's not important in the latter, but what our data shows us is that we really need to focus on getting eligible people in the front door. So you will hear from Civic Consulting Collaborative about the approach we think we might be able to take to help increase that access and also help us understand how we can better support those communities in understanding what's available. So as people become newly disabled or have a disabled child born into their families, they are more readily connected to these really life-changing services. I just want to frame for people, this is just one step in our journey in creating equity in home and community-based services. We hope that all of our efforts here will yield a more equitable representation in home and community-based services. But we know that there's other work that must be done to make sure that all of our services are culturally competent and that people are receiving the support that they need in the way that works best for them. So our commitment will be not to stop here. We will continue to analyze how we can create equity across the system. And I just want to make it really clear that we are grateful that you are here and supportive of this work. Without your expertise and insight, we most certainly would not be successful. So I'm going to pause and see if there's any questions, but if not, I'm going to turn it back over to Civic Consulting Collaborative to talk through our engagement around this project.
Go ahead, Amy.
All right.
So much.
I don't see any questions. So thanks, Bonnie, for sharing the context for this project. We had some hypotheses and then checked some of those out through the agency provider and member caregiver survey that many of you all participated in or heard about in the first summit. And what we thought might be true, you all confirmed. So many members need to be connected in order to be aware of home and community-based services. And then many members need to be supported in order to get enrolled. So this thinking led us to the learning exchanges, which we've been engaged in since we last met at the first summit, which is so we're going to be focused on the learning exchanges, results and next steps this afternoon. Go to the next slide. So why did we focus our learning exchanges with community-driven organizations as partners? Well, as Bonnie just discussed, we recognize that identifying with the disability community has a huge history of marginalization. And we also recognize that people who identify with additional marginalized groups, such as race, identity, gender, sexual orientation, often experience even more barriers to accessing services and supports due to mistrust, stigma, or just a lack of knowledge and connection. And so, as I just mentioned, and as you all know, many families and members who are connected got there through the relationships to people who were already in the system. So friends, other family members, or connections to advocacy groups. But if your cultural community isn't connected to these formal systems, then you likely have a lesser chance of knowing about the program, much less knowing how to navigate its complexity. So this is really where the trusted community-driven organizations come in and why we focused on learning with them. So they hold the social capital in their communities and act as bridge or brokers for the community to engage in the systems that have traditionally excluded them, either explicitly or implicitly. These organizations and their advocates, case managers, navigators, peer and outreach specialists, community health workers, and coaches are expert in their community's cultures, histories, needs, and opportunities, while also having expert language and understanding of how complex systems like Medicaid operate. So when we started reaching out to these community-based organizations, we quickly learned that home and community-based services are not really in most of their awareness, despite their desire and need to have more tools to support people in their community with disabilities. So hence the learning exchange. So what did we mean by a learning exchange? Next slide, thank you. We really meant that it was a mutual exchange of information and learning. So we did not go out to just extract information from these experts in the community. We designed a 2-hour exchange of information. We shared a little, we asked them questions, they asked us questions. We really created a dialogue, creating connections, relationships to the home and community-based services program and to the network and HCPF staff. So we really, throughout those conversations, identified opportunities for partnership and really furthering the network and increasing equity through the partnership. Next slide, please. Awesome. So who are these amazing organizations? You can see, well, first there's 10. You can see that there's 10, perhaps, I think, yep, there's 10 awesome logos on the slide that we engaged in these learning exchanges with about 3 to 9 of their staff members. And one organization, because there's actually 11 logos on here, was through a one-on-one conversation to ensure that we had representation from that southwest corner. But so you can see from this map that there was great diversity geographically. What you may not be able to see is that there's also immense cultural and lived experience diversity. So these organizations are specialized in supporting immigrants, refugees, LGBTQIA plus individuals, and folks living with HIV, suffering from addiction or housing insecurity. And so we are just extremely grateful to have gotten to learn with these organizations and are really excited to welcome them into the home and community-based services network today. So the next slide, please. So I could talk to you about all the wealth of information that we learned, but instead we really want you to hear from these folks about the amazing health equity work that they do every day and the ideas that they have for increasing equity in the home and community-based services program. So before I turn it over to them, I want to just quickly toot their horns because we want to just express our awe of how these experts build deep trust, first and foremost, to walk with their communities to navigate immense barriers across multiple systems, such as not speaking or reading English, not understanding US medical terms, not having a mailing address, an ID, or full immigration status, not having a phone, and having some really, really deep generational mistrust of the medical system generally. So we really just want to thank you and are excited to learn from you and your respect, compassion, and commitment to ensuring that your community is supported in their wellness. So with that, I'll turn it over to Rashawn to facilitate this awesome conversation I'm so excited for. Thank you.
Thank you, Amy, and everyone. Yes, we are also very excited to turn now to a discussion amongst 4 community navigators who participated in our learning exchanges from several different parts of Colorado. These folks are experts in helping everyday people navigate healthcare systems and access the kinds of care that they need, in addition to helping them navigate lots of other systems that are not connected to health, because there are so many challenges that people experience, especially coming from often marginalized and excluded communities that struggle to access HCBS services and many others. We learned so much from these community navigators during our learning exchanges that we thought it would be very helpful for you all to hear directly from them. And so to that end, we are going to host a lightly facilitated conversation among these health navigators about what it's like supporting their clients, overcoming barriers to accessing care, and what would make overcoming those barriers easier for their clients and for you all to also support them. So I am very pleased to introduce our team of navigators here. So first we have Elisa Alcancela. Elisa is an executive director of El Grupo Vida with 7 years of experience helping immigrant families with children, youth, and adults with disabilities through training, consulting, coaching, and other services. She specializes in infant mental health, special education. She's a cultural broker, early childhood development, research and leadership specialist. And Elisa uses that experience to advocate for the rights of immigrants and people with disabilities. So thank you for being here, Elisa.
Thank you for inviting me.
Of course. Next, we have Tara Bay. Tara is the director of the Adelante Family Resource Center program of La Puente Home, Inc. The agency provides services to the residents of the 6 counties of the San Luis Valley, which includes Saguache, Alamosa, Conejos, Costilla, Mineral, and Rio Grande. Next, we have Ms. Lily Boyce. Lily is the Denver Indian Center's Native Community Peer Outreach Specialist, and she has been supporting Native folks and their families navigate access to many different services and systems for decades. And we are very excited to have you as well, Lily. And last but not least, Sarah Marshall is with us. Sarah is a native of New Mexico who has lived in Denver for the past 15 years and worked in the world of HIV and STI treatment and prevention for over 20. He's the former Colorado HIV program manager for the Planned Parenthood of the Rocky Mountains and is working in the world of HSV and STI prevention as the program manager, prep coordinator for It Takes a Village here in Denver, Colorado currently. There's a community member, activist, and friend, and he loves his little dog Crackers more than anything on earth. Thank you for being here, Thera. So just to give folks a sense of what we're going to do today, we've got a couple of prompts that we're just going to offer to our community navigator folks here to just discuss and share some of their thinking and talk with each other about it. I'm going to help lightly facilitate it. And we'll be joined by Tasia Sin from the HCPF team. Tasia will be joining us as a kind of listener and helpful kind of commenter in moments where some of the systems questions and or issues might be where that might help. But the idea really is for these folks to have a conversation among themselves, because we know that them just sharing some of their knowledge is going to be deeply useful for you all in terms of helping understand how community navigation supports people getting involved with HCBS care and many other kinds of care. We're going to take about 25 minutes or so to start that discussion, and then we'll move into a section where we can take a few questions from you all, the audience, and have the discussants kind of grapple with some of those questions. So if along the way you have a question come up that you'd like for our community navigators to discuss or answer, please drop that in the chat, and the other facilitators will be keeping an eye out there, and we will, in the Q&A section toward the end of the discussion, field a few of those to our discussants. Any questions or anyone having issues with the tech so far? Elisa, Tara, Lily, Thera, and Tasia, y'all good? All right.
So Sean, can we pull off the screen share?
Oh, yes, we sure can. Thank you. Appreciate you, Jack. Takes a team. So, friends, each of you are essentially in the business of trying to make warm handoffs, and when you can, hot handoffs that are, so much more than just making an introduction from a client to the services, and really making sure that they've got everything they need to get their care. And the question we want you all to just start with the discussion around, and remember, as we discussed, that you can just come off of mute, jump in, you can use the raise hand function, and I'll also help lightly facilitate so that we can just make sure we hear from all of you. But I'd like you to start by discussing what it is that makes the warmest handoffs possible for you when you're helping your clients navigate these systems, and what would help you feel the trust that your clients are going to be treated with dignity and get the care that they need once they are in the provider or agency's hands and you've completed that handoff. What makes for the warmest handoffs, and what makes you trust that they're going to be treated well once you hand them off?
I'll start us off. Here at It Takes a Village, when it comes to warm handoffs, we really focus on what the individual that's coming to us for their needs, what they really, really need, and what capacity they have for self-advocacy, because that's what we really want. We want whatever we do to end result in them being able to self-advocate for themselves when we're not around. So what we essentially do is, if we do have an appointment, let's say we're going to UCH for a PrEP appointment or a linkage to care appointment, we do have facilitators of navigators that will basically take the individual in a car to the site, to the doctor. If that individual would like you to sit in on the appointment with that doctor, we also do that. We offer bilingual counseling also when it comes to that situation. But once again, the real thing is that we try to walk each individual through the process, so there is an end result of self-advocacy once we're no longer navigating. We really want people to be proficient in saying what they need and what they want, and knowing where to go to get those services at the end of it all when it comes to the warm handoff. Now, when it comes to the warm handoff, we always want to make sure that we have certified partners. We want to know who they are that we're sending the individual to. We want to know the work that they do. We want to know that they're capable. We want to know that they're competent culturally, whatever the case may be for that individual. So what we listen to is what the client needs, the participant or the patient needs, and then we find specifically that organization that we have certified as partners that can help them with those individual needs and wants and services.
Yeah, I think that's super important to have. Also, I think what we do is it's all about partnership, right? We're developing strong partnership with the families and people that we serve, but we're also developing those strong partnership with the agencies that we're going to be referring to. So we want them to know who we are, our names, our faces, because we want that trust to follow through from what we're doing with a family or person and getting them connected with the services that they're needing and wanting. And a lot of times we'll sit in with them on assessments, specifically for home and community-based services. There's a lot of trust issues in the San Luis Valley. And we have people that won't walk through a door by themselves. And we understand that, right? They barely walked through our doors in the beginning. And so we really want to honor that bravery of them. But also when they're seeing that, hey, I know Thera and Thera's done this, and my team can say that, then they feel more comfortable with that. It's a hot handoff. It's not a warm handoff. We're there, we're present. Sometimes we'll sit in on an assessment because they get really nervous. You know, there's that white coat syndrome where you get really nervous. You might have questions, but you don't know those questions go away when you're in the middle of it. And so we do a lot of preparation for that also in advance, in helping them write down questions just in case they stumble along. And that's been really helpful. So there is some pre-coaching, but there also is some modeling of some of the, the advocacy or self-advocacy, so that they can learn that they do have a voice. They can ask those questions. It doesn't have to be fear-based. And that's what we're really trying to break down, is that fear-based. We work with people that are don't have legal status or combined status in their families, and fear of deportation is a huge thing. And so really, when you can develop some trust and show that these people are trustworthy, that's really what has been beneficial to our families.
Yeah, I completely agree with you. The other side, I'm in Denver, but also we work with immigrant families who have children, young adults with disabilities. Therefore, we see that difficulty to trust the system when they don't know if this is going to impact in the future. And also the language, sometimes we feel like just only doing interpretation, and thank you for the interpreter. It's done, when you do, we provide interpretation and it's done. No, because if the language is here and the family is here, and they don't have background knowledge because they come from countries that they don't have this type of programs, it's really difficult to understand. Therefore, cultural brokers are so important to work with this bridge of supporting and to help them. I know that they want to advocate, but sometimes they don't know how to advocate because they don't know the rights and they don't know how the process goes. They don't know if they need to pay something. They don't know if providing the information, applying, is going to impact their family in different ways. And I think connection are important. Trust between the people who are supporting families, and simple message. Because sometimes the system can be so complicated, and it's not so simple to really understand. Okay, now I have this. Now, what is my right? What is the services that can I request? The other thing is sometimes they have access, but they don't have the resources because it's not in their area of living. Therefore, it's kind of difficult for them to really say like, yes, I'm in. However, I cannot receive because these specific services in Denver instead of in the South.
What would you add, Lily?
Well, I really enjoyed hearing what everybody had to say, and all of that would be true for my community. The barriers that Tara talked about and Thera talked about, the language issue, with us, there's not like Spanish, like one language that in tribes, if you had one interpreter, you could take care of the Indian community, because we have tons of native languages, which have mostly been almost wiped out due to, the effects of colonization and stuff. And I mean, we would see Spanish as another colonizer language. because if you have brown skin and you're from this country, your people initially had a different language, but I diverge. So, as I was listening to you guys, the difference in our community is our invisibility. I mean, the Indian community, Native American community, Denver Indian Center, we serve primarily the 7-county metro area in Denver, but I get calls from Durango. We get calls from anywhere here in Colorado, and it's a broad area, and I wish that we had the capacity to go with clients to appointments, but there's just me and one team member, and our job is to sit here and help whoever calls or walks in the door with whatever they're looking for, and hope that we can meet that first need ask so that they'll come back and we can talk more about some of the more long-term needs that they really need beyond what they came in for, which was food that they didn't have to cook because they're living in their car, so we don't have time to go to a lot of those appointments. Our grant says that we should be building these deeper things, but we can't. And I'm a peer advocate. There is Denver Indian Family Resource Center, which is really more focused on the kind of level of health stuff that most of these other organizations represent. But you know what? They're so busy, they wouldn't sit in on this call because they have to spend every minute providing the direct service that they need to do, and there's still wait lists. So the capacity for culturally appropriate services in the American Indian community in Colorado is, the money that trickles down to us is a drop in the bucket, because of successful colonization and genocide. So, that's the broader thing, but each client that walks in has that experience of systems that were more about harming than helping, whether it's boarding schools or, just trying to get services and being turned away. Okay, I'm getting off.
No, this is great, because I actually want to dig down a little bit, Lily, because as you said, like a lot of the communities that you support and that all of you as community navigators help support have good reasons to distrust these systems for generations back and in their own lives and their experiences. And I want to ask you all to drill down in terms of, what do you do to help them build the trust they need to actually go to that appointment even though they have these good reasons for distrusting these systems? And I wonder if there's anything you kind of wish would happen on the system side that would help them trust these systems and these care providers in ways that they can't right now.
Since I'm still talking, I will just say that HIPAA is a pain in the neck, or, when I do referrals to outside agencies, like they say, unless we can get this signature from them to say they can talk back to us about what they're doing with that client, they can't tell us, and again, I don't have time or the capacity to go out there and create those hot handoffs or create that relationship, one-on-one relationship with everybody in all the agencies that would happen, I already forgot what I was talking about.
That's okay.
Yeah, so, the things we do to try to create even them to come back here and to feel comfortable to even talk about what's going on is, we have a coffee pot here, and, we have cookies and we have food, and we try to have food that people can take to eat in their car and not just cans that they don't have a can opener for. Just making a good environment where they'll come back, and telling them about the sewing circle we have here or the native language classes, because that's really Denver Indian Center's focus, is to create kind of a cultural center. And that's why we were placed here, is that people will come here when they hear of, when they're looking for the Indian community, and they're not getting to the providers of mental health because of the stigma or even health. But here they come in, and when they're here and they have a big infected cut on their leg, we can also point out that there is Den Meridian Health and Family Services where they could get help. All they have to do is have a tribal ID or be eligible for that. I mean, you know, so we try to be that warm place they can come to even get a conversation going, even though we don't have the capacity to go out there and do the kind of things you guys are talking about that your agencies are able to do. I'm so jealous. I'll stop talking.
So for me, I think it's stop checking the boxes, right? Because I've been doing this work for probably 20 years in the community, originally as a direct service provider and now overseeing my providers. But have you guys been to a social service office and had to complete an application and navigating an application and answering questions that you don't know if it's going to hurt you later, but then that's just the beginning process, right? And then you check that box off, and then we have to go into an assessment to receive home and community-based services. And if we're not doing those assessments with the human in our mind and just asking the questions the way that they're laid out, people don't trust that, right? So being well-versed in what questions you're asking and being able to ask that question in a way that the people you're serving can understand it, not just with language barriers, but just with just human thought behind it. I think I see a lot of checkboxing, which is kind of my soapbox, and it just drives me insane when I'm sitting in there and I'm like, okay, wait a minute. Can you explain that question in a different way so that they can adequately answer it? Because I've seen some people get denied for services that absolutely would qualify, but because of the way those questions were asked, they didn't know how to answer it, or they were answering it not accurately. And so that checkboxing, I know those assessments take a long time, but they should, right? Because we want to know a little bit more deep information so that we know what exactly are the right services that somebody needs in their home. And so for me, that's the thing. Stop checkboxing, right? And we all do that. We all get busy and in our own way, but we've got to think about it. What does it look like on the back end of that? I would encourage anybody to go through that process to try to qualify, to see what it looks like on the client side of the perspective, because it's not pretty.
Go ahead, Elisa.
Yeah, it's challenge. And in our case, we don't go with the clients. We support them to be enrolled in center boards. And this has been our kind of work. However, every CCBs or center board have their unique process. Doesn't matter that have the state information to be, you know, like example, what evaluations you need to be enrolled in. And sometimes they're tricky because depending on the place that the family live, therefore is what information they need. And most immigrants, the diagnosis maybe they have in their countries, and now kind of working with an evaluation here, finding a bilingual psychologist, kind of navigating everything, who is going to pay what. It's challenge. And when you say that they don't have enough Latinos or, you know, compare with, I can see that. We work every day with a variety of families to, you know, connect them with kind of the dots of, okay, assessment, the assessment, let's go back, what things need. Can you use the IEP, yes or no? Some CCBs, you can use it. Individualized educational program, or can you use, or the IEP or the plan needs to be signed by an evaluator from the school. Again, there are little things that maybe look like little things, but for family is huge. Thinking about language barrier, thinking about, again, translation is not the same to really understand the process if I have not had experience going through the process. Therefore, one of the things is time. I agree with really capacity, like having more people to really help Do they understand? And one of the questions that I added there, and maybe it's not here, maybe for the future, but I'm wondering how many people start the process of enrollment and they don't finish because it's so difficult. After 3 months, you need to start all over again. Again, it's like, how is the process to really support them? Are we here to support them? Or are we here to put more difficulties to be enrolled? Wonderings.
And just to piggyback off of that, Lisa, thanks for saying that, because it's so true. There are so many individuals that come through our office that get involved in the system. And then next thing you know, you ask for a document, they're like, ghost. They're not there. And it's because it's a system that necessarily isn't very inviting. You know, when you put a barrier up front and then you finish that barrier and then there's another one there. Another one, you know, so it just takes a toll on those individuals that aren't in the business like we are. But I must say that I'm pretty fortunate to work at It Takes a Village because we've been doing this work specifically for 20 years straight. So we have a great system of how we can advocate for individuals. I would say we don't have the capacity to do what we do anyway, but we have hired some individuals that love what they do, that love that community, that are engaged directly with that community. When we talk about trans women coming to our organization looking for help, well, they specifically speak to a trans woman. So anything that they need is facilitated by someone that looks and feels just like them. Same with queer men of color. There's someone that looks like them. So it's always really important, especially when it comes to capacity. Lily, I pray for you and your organization to get more funding for more individuals that can come and help you out to complete the goals that you wish to have come to your organization, because that is part of it. We need more individuals, more boots on the ground that look like individuals, that sound like individuals, that we are catering to our services. And without that, it's really hard to get over the hump, you know, and it's hard work that we do. We go in this work with all of our heart and all the conviction. And then day after day, you kind of feel beat up, you know, or not recognized, or that the government is not really necessarily here to help us. It's just a barrier in a lot of ways. So I think that's something we really should look at, especially when it comes to those governmental entities and individuals that are out there that are having these discussions. Always keep in mind that the people that are on the ground are doing the work. They are actually doing the work. And anything that you're fluffing up in your mind, oh, we can do this, that it must be grounded in the work that the people are actually doing.
I'm glad you said that there, because I also think, who are your stakeholders and why are they not at your table when you're making decisions? They have the wealth of knowledge, right? The recipients of services, the service providers. I've been on a lot of top-down models that don't work because those stakeholders are never invited to the table. I'm not sure why, if it's fear-based or if it's just not thought of, but when you use that top-down model, it doesn't work and it hasn't been working. And so how do we get those voices at the table so they can understand exactly why it's so difficult to navigate systems that have been put in place by people that don't know what it's like?
I would add to that to say that that is super true. And in my past job or two, I was a family advocate or a peer advocate in the mental health system. And I used to sit on committees, HCPF committees, all these committees. And it's a terrible feeling to be sitting in the room with all these people who represent agencies and you're trying to get across your point. And, you know, you're patted on your head and said, oh, yay, we're so glad you're here. But your recommendations don't amount to squat when it comes to how money is spent. You know, everybody they'll, you know, as long as it doesn't cost anything, they might adapt something. They might hang some pretty pictures, Indian pictures in their offices, but really meaningful things. And, you know, it is hard to be. So what I would say before I go any further than that is that not just one or two people representing you know, the community, but there has to be like, you know, a one-on-one. If there's 10 professionals representing 10 agencies, they should each have a client from their agency there with them, co-representing, you know, not one person who's the peer representative among 10 professionals. You know, it is soul crushing to do that, to be that person in the room for years, because people talk about their clients and the problems they have in ways that make you want to run screaming from the room, you know? Okay, I'll stop.
Yeah, no, super appreciate this discussion. And just on that last point, I used to do a lot of youth work, and we would never let one youth be the only person representing all young people. It had to be at least a pair because they support each other. And it's so hard to be the one minority or, you know, stakeholder or client or whatever it is in the room of other people. So really appreciate you all, you lifting that up, Lily, and this discussion. As we know, I'm sure we could have this conversation go for 3 hours and just stay with this question. But because we are talking about home and community-based services today and equitable access there, I want to ask you all if you can describe a little bit about, you know, all of your communities are very different, have very different needs and contexts. So can you tell us about one of the ways in, or some of the ways in which a typical client for your agency might make use of the home and community-based services? What would that look like? And what would you or other navigators like you need to feel comfortable and capable supporting your clients accessing those services? Because they're so underutilized, this is a key part of what we're trying to figure out and support HCPF and the rest of the system actually do. Well, how would your people use home and community-based services in their specific context? And what would you and your folks need to feel comfortable supporting your clients accessing them? Sorry that my computer is giving you the thumbs up because I like you all so much.
I think I can start. We have from 0 to 100 people that could utilize services. The problem, I think, is the knowledge about them and the lack thereof. And I think I talked with Amy during our initial interview of things have changed over the years that I have seen. And if I had not followed it, I would not know how to help people get enrolled in services. I mean, most recently we switched over from one agency doing all of the single entry point stuff to another one that was outside of the San Luis Valley that didn't know the San Luis Valley. And we didn't know who to contact as providers who have been doing this for years. And we struggled figuring out who to contact and how to develop a relationship. And to be honest with you, we haven't done it yet. Because it's so hard. And so when big changes are made, I mean, how do you get that word out to your grassroots people or to your community-based service providers so that they know, hey, this is the new people in town, and this is who you contact, and this is how you know, so we can set up sometimes to talk to them about how do we get them involved. But we've done stuff from just straight management through life alerts, to full-time caregivers and being able to help them understand what's available to them. I think there's a lot of people that don't receive services that definitely are eligible and should, but it's an educational component for us in this area. And because we have 6 counties, right? So we knew every single entry point in each county, and now some of them are a different single entry point. So we just don't know how to help navigate that, which has been really frustrating over the last year. And we've seen a drop in enrollment. I know we have, because navigating that new system has been so extremely difficult.
While you're on that, Tara, I just want to say, can you drill down? Is there something you know would help your folks understand these systems better and how to navigate them for your clients getting access to HCBS services?
I think it needs to start out at Department of Human Services and having knowledgeable people, you know, from the start of the application process on who do you go to next or who's going to be contacting you. There's a lot of people that won't answer a phone number that's from an out of our area code, right? And so for they're expecting that call from a different area code, of course they're going to answer. And I think having the knowledge where you're applying and spreading that knowledge, but also knowing the community and who is getting people linked up to services. so that they can have that knowledge as well, because we're doing the work with them, alongside them. And so they're seeing our frustration as well, which is just unfortunate.
Yeah. Elisa, there, Lily, how would your clients actually make use of HCBS services if they could access them? And what more do you and other navigators like you need to feel capable and able to connect them?
Well, since we work with individuals living with HIV, and some will need long-term care as the disease progresses, I believe that it's just really in the foundation of how everything is run from the top up. We sometimes get the information so late, or undefined. That's great to have a program, but if you don't come into my office, because I'm already busy doing things, right? So you're offering this new program, or not so new program, but you revamp this program. And I personally, as a person in charge of managing, don't have all of the information that I need to facilitate someone else's navigation.
How are you feeling?
Was that me or somebody? Okay, sorry.
No, go ahead. Sorry. Reminder to please keep yourself on mute.
Yeah, but I always just feel that just sometimes we as providers, as navigators, as caretakers of our community are just the last to know about a lot of things. And when you're the last to know, you're usually not the first to utilize it. When you don't feel like you're a part of the solution, they're over there doing whatever they want to do. They have not involved me or my organization. So we're going to continue to do what we're doing and try to do it as good as possible. So I think sometimes when things are happening, as I appreciate you all coming and bringing this to the forefront for us, because it's something that we probably could utilize here at It Takes a Village wholeheartedly and help a lot of our clients live successful, productive lives, no matter what that looks like. But it's just now that I know, I can get involved. But I think a lot of organizations have no idea who or what you all are doing at this point in time. So I think when it comes to federal grants and state grants, who has the money. Who exactly needs to partake in some of these things or advocate for them or give them to their clients. So I think we need to really do a little bit more better outreach to those organizations that need this information to help them put people onto the services.
Appreciate that.
In your question, I can't think of anybody I know from the Indian community. I know white people who have gotten HCBS and done great things with it and are able to live their best life they can. But I don't know anybody from my community who has successfully navigated getting HCBS waivers. I'm sure they're there. I don't know them. I know 2 or 3 people come to mind immediately who have come through the doors. One person I actually referred to, what is that called? To a single entry point agency within the past couple of weeks because of the conversation we had. So, woohoo! But because systems change so fast, I always think of sending people to RAISE, but now those may or may not be the ones they need to go to. They now need to go to single entry point entities. So, it changes, like Tara was saying, all the darn time. But there's one lady whose brother, I'm going to just say her brother was in a car accident and got a terrible head injury. And his capacity is severely impacted, and the hospital and the people who were working with him, because he was somewhat violent, he basically got kicked out of all services. So nobody wants to work with him. And so the sister took him in. This sister has 5 kids or so. And, she took him in. She's in her early 30s. So, she's busy trying to have her family, but she's the sister. She took him in and she can't get services for him. And he is severely incapacitated behind this. And he hasn't had the training how to deal with his brain injury stuff. Nobody's helping them. So she called me saying, help. And so I talked to her and I talked about the Brain Injury Alliance where they have navigators. And I talked about, she said somebody had given her the number of Rocky Mountain, blah, 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 which is the single point entry in her county. And So I said, that is the direction to go. And I believe that you want to ask for HCBS waiver. That's a big thing, is she doesn't have the language to know what to say, hey, this is the kind of services I want. So all I can, before she talked to me, the best she could do is say, help. He's falling through all the cracks. I don't have the capacity to do this for very long. Help, 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 and she don't know what that means. So at least I was able to say, there is this waiver. I sent her a link to the HCBS waiver. I sent her a couple other links and said I would follow up. Now, it's been a slamming week and a half since I talked to her. Haven't followed up yet. I want to find out if she actually got help, if when she talked to somebody at the Rocky Mountain place, if they actually helped her, if she slid through the cracks too. I don't know. But you can look at that example, and I'm not giving much details on it for her privacy, but that's how everybody slides through the cracks.
Yeah, so sad. But thank you for that really concrete example. Elisa, is there anything you would add here?
Yes, because we work more kind of helping families enroll them. I think one of the doesn't matter how many times you explain, like all the services that you can receive when they are accepted. I think one of the challenges is finding the providers. I think it's huge. And I don't know how many calls I receive, like, do you know about music therapy? Do you know about this? Do you know about that for my child? And sadly, is not enough providers around to really support what they have. In that case, they're good services and they have, what they need, but in the community, it's sometimes really hard to find what they need at this moment. Yeah.
Yeah. These conversations can be kind of a downer because there is just such a huge lack of resources and capacity at the local level, where folks who actually genuinely badly need this kind of care start very often. Tasia, I wonder, just to bring you in, if there's anything that you've heard that you want to respond to, or the things you want to just comment on about how these HCBS services work right now, or some of the issues in the systems that these navigators have mentioned.
I think that they have all highlighted things that are real and not working, and things that we have to work on. And I am so humbled by the work that they do, and so grateful that they spent the time to do this with us, because I think that this is how the real work happens. Like, I just keep thinking of the quote, "Look for the helpers," right? And here they are doing it every day, heads down. And I just want to be part of that work to help support them to do it, because they are out there doing it. So what can we do? What barriers can we remove? You guys might have seen me typing. I was taking notes even still from these conversations about sort of how we can move forward. So just thank you.
Of course. And we want to take questions from you all in the audience soon. So please don't forget that you can drop questions for our navigator panel here in the chat if you would like. But yeah, I just want to round out that piece to say that it is, we don't bring these folks up here to talk about all the problems just to like kind of bash the systems, right? Like that we know that so many of the people who are part of these higher level systems, the single entry points, the community, the care management agencies, it's just like so many other systems that people signed up and joined to help because they have a heart to make things better for people. And it's just the nature of systems, sadly, that as they get more complicated, they also kind of get in the way of the folks who want to do that sort of work. So we're really glad to be in conversation with you all about how we can remove those barriers, and really want to respect that was a thing that HCPF came to us for help with.
Can I just answer that, Tasia? I think one of the biggest things that needs to happen is to encourage partnerships and start breaking through those silos. Encourage your single entry points and, encouraging them to know who your community service providers are who are referring to you. Reach out to them, have conversation, develop relationship, because we know that model works. And so if it's an expectation, not just an option, I think you might have a lot more partnership, which will also create a lot more trust when we're doing those warm and hot handoffs. I also think looking at, and this is for all providers, looking at who you're hiring, like Thera, I butchered your name, said, having people who represent your community. And I know that's difficult, and hiring has been difficult just across the state, but we have a chance to rebuild that as we're doing hiring and being very intentional about that, so that they do have an option to work with somebody that's them. Right. And you talk about building trust. We have a huge Mayan population here. And had we not been able to work with some of the people that are trusted in the Mayan community, they probably wouldn't come to us. So I think those relationships are really that key to success.
Thank you for that. And I really want to dig down on that. I see a few more questions coming in that I'm going to try to sort of merge a few of the threads. There's a couple of people in the chat asking about how you all train your existing staff and keep them up to date about resources like HCBS, that in addition to providing the emotional support they need. And there's another question asking about how, is it possible to have case management agencies come spend time with you to provide education on some of these resources and enrollment processes? And I wonder, can you all respond to that? How would you like for these agencies, these systems folks to engage with your organizations in these ways that'll support you and educate your staff? And what would feel right and appropriate and functional for you when it comes to building those relationships and getting support from these agencies who do want to help?
If I may, our organization is called It Takes a Village. And that's basically it. It takes a village. It takes each and every one of us coming together, displaying our own personal talents, our knowledge, our expertise. So we're always open to anyone and everyone that can help our clients become the best people as possible. Partnering is key to only thing that I can say, the key to my success. Because knowing people, knowing what they do, know what they're good at, know what they're bad at, is the way I maneuver and go through life in general. So when it comes to providing these services, anyone out there that is looking to join forces, please reach out to us, any of us. I don't believe any of us here in this panel would be like, oh no, we can't work with you. It just doesn't sound real or right. So just anytime that you feel like I have no idea about this subset of the population. I don't have any knowledge about Native Americans and what they're going through. You probably want to reach out to Lily. She's probably a great resource. She can probably give you some good information. And I don't think she would bat an eye at someone helping her and helping her clients. So I think it's just really taking that initiative for yourself. As I said beginning about self-advocacy, we as navigators have to do that ourselves. We have to advocate for ourselves and for our organizations. So I think that if it's something that you really want to do and your organization is set out to complete the circle of a village, then just you personally reach out. Like it's really hard enough because I have a staff of 3 individuals that do this navigation. So it's really hard for me to take time out of my day as I'm navigating to be like, oh, let me call this organization to see what's up with them. Like, I think when you know that you can help, you just jump in and help. When the fire's happening, you don't look around and be like, well, somebody's gonna get some water. I hope. You jump in and you ask, what can I do? Who has the hose? Who's turning it on? So I just say, I think a lot of organizations need your help, need your support, and you have to be able and willing to do that without someone prompting you. you know, because I do a lot of things without prompting. I'm just like, oh, let's just go. Let's try this out. Let's figure this out. Let's find out who can help us out with this, you know? So I just think jump into the fire. Don't let it burn you. Just come on through.
I can continue. I think it was like, I heard 3 questions and I'm to answer. First, about the staff and resources. Well, we are working with different organization agencies who support and provide us information, and we provide to our staff, community navigators. Mental health for our staff, yes, is so important, extremely important. And this is why I think it's important to have retreat, and I got it. Again, funding is tricky, but having opportunity for them to have a time of reflection and journaling, or different things to really help them understand. Currently, El Grupo Vida is helping a lot of the newcomers, predominantly Latino immigrant from Venezuela, and has been very unique process for us to really navigate shelters, to navigate, how do we connect them to the different counties. I think one of the challenges that I face is we have counties that they provide, an agency that they provide, like Rocky Mountain Human Services, they provide amazing support, amazing way to connect families. But we have other counties that they have difficulty due to not having a lot of staff, not having, different things to really help. And sadly, we see this discrepancy between which place you live and which resources you can get. And this is not fair. I have family that they move, they try their best to go to a specific place because they are going to have more resources and support than other places.
I'll jump in on some of those questions. For us, we've got a strong supervision system in place to kind of help battle some of those residual effects of things that we're seeing out in the work that we're doing. We do team supervision, but we also do individual supervision to really process some of the stuff that we're going through. But then we also have a self-care plan. Each person in my office has their own self-care plan, but they have a accountability partner. So they're partnered up with each other and they really hold each other to their self-care plan. So that's been really helpful. As far as community resources, there's a lot of resource guides online and offline that are updated quite often, and those resource guides. There's also like Unite Us is a huge resource across the state that they're trying to grow in different communities that show a lot of different resources and quick referral processes. We've been utilizing that just recently, but also we have a resource bank. So anybody that identifies a new resource, because we're always looking for them, we put it in our little resource bank spreadsheet and we're like, hey, and send out a mass email saying this is what's out there. And somebody is always in charge of learning how to navigate that system, because we don't want to send people in there to fail as well. So we want to know eligibility. We want to know what documentation they need, those kinds of things. So it's not just learning your resources, but how do you successfully gain those resources? And then the final question, I think, was having case management agencies spend time with community organizations. We all say yes. I've not seen one. And like Thera said, there is not one agency that would not welcome that, because we want to know what you do, but we also want you to know what we do so that we can play off of each other's strengths. And so I'm not sure if there's anybody from representing the San Luis Valley, contact us. I will put my email address in the chat box, and we would love to sit down and meet with you. And we like to travel too. So don't think you have to come to us. We will come to you.
Yeah, I know that was one of the things that we felt excited was possible as an outcome of these conversations, is just more of the kind of relationship building amongst and between agencies, and almost like the diplomacy that needs to happen between the community-based organizations and the systems being supported. But Lily, you wanted to add something here?
Yeah, one of the questions was about what training we have, and we've had trouble finding training for us as non-clinical people. We tried to get the peer training and that statewide peer training, and it's like applying for a graduate school to try to get into the peer training, first of all. And then after we went through that, they denied us. You know, my coworker, Mickey, she couldn't do it because she's actually doesn't have any diagnoses or nothing. She's a peer of my community. She's been in the community. She is a networker. She's involved in a lot of cultural stuff. So she's a community peer who wants to help people, but because she doesn't have a diagnosis, she couldn't take the peer training. For me, their response was, well, maybe you're a little overqualified, which is, you know, like, okay, but I don't have any certification that says that. I need to take your training to get that, you know, and my experience is a bit dated, you know. I mean, I haven't been swimming in those circles all the time for a while, and with each administration, they revamp everything, made BHA, and, you know, I mean, just because I've been doing this forever doesn't mean I don't know. I know all the fresh, nifty stuff, you know. So, you know, we've taken healthcare, you know, that first aid training, the first mental health first aid, you know, we've done some stuff what we can, but we're looking at an agency, trying to see if we can get an agency to help clients who are trying to get Medicare, Medicaid, food stamps, because we do a lot of that, just sitting here at our computer helping people. But I mean, so yes, people want to come in and work with us, definitely. The only caveat I would say is there's this myth out there that if you're an American Indian, you got all your health care taken care of, you get free school, you're getting monthly stipends, that we're living large here. That is so not true. So agencies that contact us are usually looking for us to help their client with something. They're not usually offering to help us with anything. So, you know, if you're going to come, I want to work with you, but bring something, even if it's knowledge, you know, to help us, because we don't have that much money, or our clients don't, you know.
Certainly not. Yeah. So consider this, listeners, a big help wanted sign that's now posted for you from community or agencies. I want to just pitch, because we have 3 minutes left, and I just want to see if one or two of you can just say briefly a word about technology, because there's a question in the chat about if you feel that technology could help you and your teams reach more applicants in any way. And I know we heard a lot that the relationship with the technology is kind of cuts both ways, because a lot of your clients struggle with, you know, even just getting into their email, or they don't know how to use the computer. They don't navigate an app well because it's not their way. But can technology apps, different tech, have a support for you all? And you say a brief word about how, and I think we'll have to leave it there.
Okay, I'll take this one. I was fortunate enough during the pandemic to work for CDPHD, excuse me. And then I developed a system for social media navigation. And it's basically a 10-step plan of how small organizations don't have the capacity to hire someone to do social media, but a plan. It's called Simple Successful Steps to HIV PrEP Navigation Online. And I'll put it in, I'll put the thing in the chat, but it's just really simple steps that organizations can take and build a plan out for their organization, how to connect with individuals out there, to post things that will intrigue audience to come to your organization. And also you can fill out forms, things of that nature, just to make things a lot easier, because a lot of people are utilizing the internet to convey different points or get things done, be it banking, be it grocery shopping. And so why not navigation online? So I'm happy to share that with you all. It's such a great tool to use. it's a lot of work if you're going to do it, especially small organizations like ours, but it is doable. There's a plan, there's a guide that'll help you break it all down. But social media and technology is very important for all organizations in the year 2023.
So I'm going to be the devil's advocate on that,
Yes.
because we are in frontier rural Colorado, and there is huge internet deserts down here. One of the examples during the pandemic, when everything school-wise went to online, we had families driving 20 miles to a school, to a library, somewhere where they had to sit in their car to access Wi-Fi. So for us, that would not work. And even cell phone services, there's some services that or some providers that work in some areas, some that don't work in other areas. So we're not metro, we are frontier. We are very, very rural. And that just wouldn't work for us. Now, for metro areas, wonderful, that's great. But when you think about children, we had a family of 5 that were sharing a computer and spent 8 hours a day in a car doing their learning, that they had to drive 20 miles away, sometimes 30, 40, 50 miles away, just to access internet service.
Thank you both, because that's just a perfect picture of how the technology cuts both ways, and needs to be an app or social media or a new tech application is not going to solve everything, but it needs to be applied specifically with the context of the grassroots in mind. But with that, I'm very sorry to say that we are out of time, and we need to wrap this conversation up. But we just want to say thank you very much again, Elisa, Tara, Lily, and Thera, for being part of the conversation and for being part of our this project. We have learned a ton from you, and we hope that everyone listening has also learned a little bit more. And with that, I'm going to turn it back over to my team for our next piece here.
Thank you. Just give us 1 second to transition. Awesome. Can you advance to the next slide, please? Great, thank you. Once again, my name is Jack Becker with the Civic Consulting Collaborative. Our recommendations are informed by the research and external engagement we conducted over the course of the project. Many of the recommendations are heavily informed by our learning exchanges with community-driven organizations, such as those that we just heard from. And they're focused on specific things that we believe HCPF can continue to focus on in establishing authentic connections with and support for community groups, connectors, and potential current members, as well as eligible but not enrolled members, and to help bridge the gap and reach folks who could benefit from HCBS. So while we're not going to detail in full the draft recommendations, I'll provide a high-level overview of each of these, and then we should have some time to either take some questions, receive some comments. Next slide, please. So as we heard today, a focus on trust and relationships is critical to ensuring communities underrepresented within HCBS have awareness. HCPF and the Office of Community Living have done much to elevate the importance of relationships and trust, including hiring from those with learned and lived experiences and those who have worked at the local and county levels. And we see a commitment as further elevating through 4 critical pathways, in particular focusing on including more community-driven organizations. So this can look like HCPF as an information provider, in which we see HCPF has a great opportunity to highlight community-driven organizations through their email listservs, their social media, and other more sort of one-way avenues that they have for raising awareness, highlighting stories, and sort of bringing local or bringing community voice and awareness into what they do. As a convener, HCPF continually brings people together for conferences, panels, public meetings such as this one, to develop constructive two-way conversations and examine topics. So continuing these opportunities can be expanded to highlight the critical role community-driven organizations play in driving greater health equity in communities statewide. As a facilitator of relationships, HCPF often makes warm handoffs and direct contacts for members, providers, and community-driven organizations. This is a significant value add for community-driven organizations, as some of which we just heard previously, especially when working on complex navigation. So we see this work as being expanded to make clear how an organization can access assistance from HCPF, in addition to focusing on making direct connections with CMAs, single entry points, county boards, county agencies, and others. And then finally, as a capacity builder, HCPF may consider bringing together community-driven organizations with community management agencies, SEPs, CCBs, county agencies, and others to really develop those relationships and conduct shared learning, such as what we did throughout this project. Those would be more in-depth opportunities and really focus on elevating trust and relationship building. Next slide. Driving toward greater equity in HCBS enrollment and utilization requires increased awareness and dissemination of information about HCBS in more communities throughout the state, particularly in communities of color where we're seeing large gaps in participation. The opportunity here is to work from where state employees and programs are already present. HCPF can examine opportunities for more integration in statewide training programs. For example, some community-driven organizations reported having currently or previously been certified application assistance sites, enrollment or Medicaid assistance sites, or pursuing other trainings. We just heard some of that discussed through the state or county, but HCBS did not always show up as information or did not always strongly show up during these certification and training opportunities. Increasing awareness for state employees working on all sorts of health-related topics is also a critical avenue to pursue. At any given time, there are dozens and dozens of health-related campaigns seeking to reach communities throughout the state. And there are also many state employees that interface directly with community members, community-driven organizations, and others that could benefit from this information and help integrate it directly into that health campaign. Disseminating HCBS materials by partnering with community organizations, such as those we heard from today, to promote materials and integrate into their normal operations can also be a significant way to increase awareness and enrollment in underserved communities. And finally, utilizing the new community health worker legislation to embed HCBS into the system should also be closely examined. With the passing of new legislation, it's anticipated that a new cadre of community health workers will be hired and trained across the healthcare system in Colorado, and that this could be a golden opportunity to infuse HCBS into the rulemaking and procedure process that federally qualified health centers and others must follow when staffing these positions. Next slide, please. Across all our stakeholder engagement, we continually heard a need for updated materials to support direct outreach to current and potentially eligible members, including to support those navigating. This included developing materials that are simple, affirming, and with actionable language for print as well as electronic formats. In particular, including those who will use and receive the information in a process of transcreation and co-creation of those materials will help ensure that they are culturally validating and usable for their needs. We also heard that clear visuals, such as a process map, could be created to better help orient and guide those that assist with program and resource navigation. And we continually heard that a more organized location to access materials online would greatly improve access. Across our conversations, financial eligibility was a top concern and point of interest and questioning. And in particular, there was significant interest in having more materials and knowledge to explain buy-in programs and ABLE accounts, and more examples that highlight exact numbers and specifics and not just percentages or generic thresholds of financial information. This work is ongoing through an additional ARPA 3.04 project that HCPF has. And so some of this is currently being implemented. So that's really exciting. Next slide, please. And finally, accountability and support systems must ensure that navigating towards successful HCBS enrollment and utilization is not dependent just on the individual one encounters within the system, but the broader system is oriented toward people with disabilities and older adults, their advocates, and community. HCPF can provide transparency by evaluating enrollment and utilization data regularly to assess progress on equity outcomes, by analyzing and sharing regional data based on demographics, such as ethnicity and race, gender and identity, geography, and language. HCPF may need to develop additional standards and evaluation protocols for case management agencies to support individuals navigating marginalized situations, such as transgender individuals, unhoused, undocumented, various immigration statuses being navigated, and those working in the cash economy. This might also include communities of color and populations currently underrepresented in HCBS. In addition, requiring local agencies to have a process in place to prioritize referrals from those individuals or community-driven organizations can be explored, and requiring consistency in the information and support given at the local level should also be further explored of how to provide accountability and continuous support. Next slide, please. So now we have about 5 minutes. We'd like to hear from you and give us a sense of where you think we're on track, where we might further explore. Again, these are our draft recommendations. We're continuing to build these out over the summer before we provide anything final to HCPF. So we'd invite your comments in the chat. And then we can either take those as they come or perhaps invite one or two of you to come off chat and share, if there are any comments or questions. Thank you for sharing, Michael. Commenting on agreeing with the need for more organized information, especially around financial thresholds. Other areas where perhaps we're on track or where we might explore further. Great. Okay, well, we will be sharing a very brief satisfaction survey that also has an opportunity for you to comment. So we will hope that we receive some comments through there if you have any. And with that, I am going to ask to advance to the next slide. And I just want to thank you all for your participation today. You all being members, caregivers, advocates, providers, and agency representatives that make the system work for tens of thousands of Coloradans. A huge thank you to Lily, Elisa, Tara, Thera for your participation, sharing your time, your expertise, your reputation with us. Much appreciated. And over the next month, our team will be finalizing our project report, including recommendations to the department, and that will lead to an action plan. And so with that, I'm going to turn it over to Bonnie Silva, who is going to close us out. Can advance to the next slide, please.
Thank you so much, Jack. And final stretch, friends. It has been, I think, an information-packed, powerful, almost 2 hours. And in terms of the satisfaction survey, we are really working to make sure that we are continuously evaluating how we do engagement. And so I would be deeply appreciative if you took this satisfaction survey that would, take 60 seconds or less of your time to help us achieve that goal. If you can go to the next slide, please. I also want to highlight resources for all of you who have a desire to be more deeply engaged in the work of the Office of Community Living. Here we have links to our stakeholder engagement calendar, links to how to contact us directly. We host a series of webinars, our webinar pages, and then we also have a newsletter, an American Rescue Plan Act webpage, and then memo series. We are working, I think, very hard to make sure that we are engaging in meaningful ways with our communities, and certainly learned about a variety of new ways that we're going to explore moving forward. If we can go to the next slide, please. All right, and with that, I also want to extend my heartfelt thanks to Lily, Elisa, Tara, and Thera for bringing their expertise to this Equity Summit. I think they highlighted such extraordinary ways in which the programs that we operate are viewed from the ground up, from the people doing the work with connecting to the communities that we also desperately want to connect with. I think that they highlighted in really eloquent ways how these organizations are often under-resourced in serving communities that are maybe not at the forefront or even invisible as system design is happening, and really I think have provided a great perspective around how we can leverage, our case management and care coordinations to support those community-based organizations and connecting people with what can be life-changing services. So thank you for your time, energy, and effort in helping us figure out how to do better in serving the communities that you represent and the communities that maybe weren't represented on this particular call. So definitely appreciate that. Hats off to the Civic Consulting Group and to the HCPF staff that have been engaging on this work. We will be crafting a final report that will be made available to the public using your insights and expertise that will craft an action plan for us to implement. So this has been some deep engagement on the front end, but please know that as the Director of the Office of Community Living, you have my heartfelt commitment that this is just a start and that we will continuously evaluate how we can do better as we move forward. And with that, I'm going to give you a solid 8 minutes back in your day. I hope you use it to hydrate, perhaps even go to the restroom in this virtual environment. I don't know, maybe start your care plan that Tara talked about. I think we all probably need some care plans. That is just a fantastic recommendation. And again, thank you for all the work that you're doing out there. Deeply, deeply appreciate you and your engagement on this important project. Have a wonderful afternoon.